Right. So after the talk on cell adaptation, we now get to cell injury. Right. So cell injury, remember we had a normal cell, which was at homeostasis, which could be subjected to stress. Then from the stress, the cell would adapt. But inability to adapt, remember I said it leads to cell injury. And this cell injury can either be reversible or irreversible. When it's reversible, the cell will go back to its normal homeostatic position. Then when it's irreversible and it actually leads to cell death, which can either be necrosis or apoptosis. And the two are going to be quite different when you compare um, when you compare the mechanisms that are going to be there for us to have either cell injury that is necrosis or cell injury that is apoptosis, right? And for a cell to uh, go back to its homeostatic levels, it should maintain those following four things: membrane integrity, ATP generation, protein synthesis, as well as genomic integrity, right? So it should be able to maintain those four things. And when the injury is going to be reversible, that's going to be mild. And this is where there's small decrease in oxidative phosphorylation. If you go back to your Robbins, it's not going to be a complete absence of your oxidative phosphorylation, right? Then maybe I'll skip the normal cell things, but okay, this is a diagram that shows irreversible versus reversible cell death, but I won't use that one. So we'll go to the causes of cell injury. So causes for cell injury can either be divided into genetic or acquired. Anything that is causing anything should be divided into your genetic causes, then your acquired causes, right? So your acquired causes, you further subdivide them. There will be more, they will also come in sixes, or if you want to put them seven, whichever way you want, right? So you can also talk about genetic and acquired. The acquired ones, you think about physical, you think about biological, think about hypoxia, you think about nutritional imbalances, you think about chemical as well as biological agents. Right. And most importantly, oxygen deprivation, which is your hypoxia, will lead to cell injury. Right. How this reduces the oxidative phosphorylation, which you remember from your biochemistry that it was oxygen dependent, right? So hypoxia is going to lead to cell injury, right? And you think about what really causes hypoxia, you go back to ischemia. The two are not really the same words. Ischemia is where you have a reduced blood flow such that the oxygen tension at tissue level then becomes low, is the hypoxia, right? Or maybe someone has a respiratory failure and they are not breathing well, then you're not going to have um, adequate oxygenation. Right? Then when you look at the chemical agents, you're thinking about drugs or poisons that can actually even affect hemoglobin levels or anything. I'm really not going to talk about those chemicals. Then you can also think about physical agents, for example, trauma that can cause cell injury. You can think about infections and under the biologicals, any bacteria, for example. For immunological, you can think about immune complexes being deposited. For the genetic, you can have problems with the karyotype or whatever, which leads to problematic DNA, beta amino acids, or you can even think of things like sickle cell disease, which can lead to sickling of cells and eventually cell death, right? Then there are what we call mechanisms for this is the hypoxia, mechanisms for us to have cell injury, which is basically the pathogenesis. Right. So these are the 4 types of hypoxia. Just thought of it. It's quite important for exams. You need to be able to know this. I'm sure from physiology, you remember your Ganong, it is something like this. There is what we call anemic hypoxia. This is where you have insufficient hemoglobin. Then you can also have hypoperfusion hypoxia. This is ischemia related, where there's a decrease in blood flow. And there's histotoxic hypoxia, where there is poisoning of the cellular machinery that uses oxygen. This is where we think about poisoning, for example, carbon monoxide, arsenic, and the likes. Then there's hypoxic hypoxia. This is where there's a decreased fraction of oxygen in inspired air, and you end up with a VQ mismatch. If you remember your respiratory physiology. Then we have what we call reperfusion injury, right? Where ischemic cells are energy deprived and full of calcium. I'll talk about the mechanism shortly. And the irreversibly injured cells can be recovered by reperfusion. However, the reperfusion, think about if you have reperfusion to a site which was almost dead, then you bring cells now that can further worsen the injury, leading to necrosis. And there can be failure of the antioxidant repair system, which causes free radical accumulation at a site. Then you end up with necrosis, right? So for the mechanisms that we have for us to end up with cell injury, right? Remember, the injury can either be reversible or irreversible. So there are 6 basic mechanisms, and one of the major ones is what we call mitochondrial damage, right? And mitochondrial are essential for us to have cell injury and cell death pathways. Even when we do apoptosis, you look at the pathways, you see that they are dependent on mitochondrial pathways as well, right? So take an example where there is an increase in cytosolic calcium, or there is an increase in reactive oxygen species in what do you call it, in the cytosolic compartment, or there is an increase in oxygen deprivation, right? All these things, what they lead to a failure of that oxidative phosphorylation, which uses mitochondrial machinery, right? Then gosh, what did I do again? Okay, I skipped the page. Okay, that's fine. No. Okay. Then once you have abnormal oxidative phosphorylation, we're going to have reactive oxygen species, and we release what we call apoptotic proteins, the main ones being the caspases, which we are going to talk about for apoptosis. Then we also have cytochrome C, right? Okay. Then cause number 2, or mechanism number 2 rather, for cell injury would be a loss of calcium homeostasis, right? So basically, let's just put it as calcium or homeostasis, or a decrease of calcium in the cellular space, right? Then another cause, I won't really talk about these ones, they're not that important. Another cause would be DNA damage, that leads to apoptosis. You can have ATP depletion that leads to apoptosis as well. Can also go to necrosis. You can have the membrane integrity being damaged. Think about things that actually put pores in a membrane. This is a diagram that shows us maybe mitochondrial damage. There's oxidative phosphorylation or anything that can decrease oxidative phosphorylation. You have a decrease in ATP. Once you decrease ATP, there's going to be an increase in anaerobic glycolysis that is non-oxygen dependent. And there's a decrease in glycogen and a subsequent rise in lactic acid, which leads to acidosis. And once there's acidosis, we're going to have clumping of nuclear chromatin in one of the steps that is going to start cell death. Once you decrease ATP, there's a decrease in function of the sodium pump. You remember the sodium pump, the sodium potassium ATPase pump, and then there's increased influx of calcium. This you remember if you know about the glycosides in the heart or Bain or digitalis, things that you did in CVS physiology. So there's an influx of calcium and an influx of potassium, and that leads to endoplasmic reticular swelling, cellular swelling, loss of microvilli, blebs, and the cell eventually burst. Right. So I was talking about defects in membrane permeability, which is a feature of most cell injuries, and this can only lead to necrosis. And necrosis, by the way, is almost always going to be pathological. Necrosis is always going to be pathological versus apoptosis, which can be pathological or can even be physiological. Remember from your embryology, during digit formation, you want to have necrosis in the webs, right? Okay. So there is no point for me to read word to word from this document. Some of these things you can look them up just for maybe interest sake, but I don't think this would be for exam purposes for you guys level. Right. Okay, so ideally, I want to describe apoptosis and necrosis in separate videos, but that's going to be the end point from these cell injuries, right? So you are, yes, going to start off with the cell injury, and you end up with the apoptosis or the necrosis, which I want to do in separate videos. But there are morphological differences for cells that have a reversible cell injury versus those that have an irreversible cell injury. I'm sure you must have done this. It's actually done in the UZ curriculum. Reversible cell injury, you have cellular swelling, fatty changes, loss of microvilli, plasma membrane blebbing. Then you have also mitochondrial swelling and ER swelling. Right? But when you then have necrosis, you start to see things like nuclear shrinkage, fragmentation, breakdown of the plasma membrane, or pores that allow things to go in and out. There are going to be differences between the two. Right.